Yeah, yes, sir. I
Yes,
think when
please.
you're speaking, it's clear. I think we should start. It's 8:35. Mangankar, sir, we can begin.
Yeah, you want to start with something or
Y-
should I straight away
You
start?
can start, sir. You can start. Thank you.
Yeah. Good evening, everybody. This is a great opportunity for us to begin. I mean, today's talk is, of course, on a very wide area of parenting, which I have started speaking in 1994. To be more precise, the first talk which I delivered for the parents of the corporation school in Mumbai. And well, the journey is of that. And we have seen a lot of socio-cultural and phenomenological change in parenting. We have seen the paradigm shift of nuclearization, and that's why it's going to be very interesting to listen to. But my first question always was, why do parents need training on parenting in humans? So the question is very wide. I mean, it's very difficult to answer also, but definitely being a cognitive creature on this earth, we are not instinctual parents as such. And the instinctual parenting as such, we had been always comparing with the two extremes. That one with the kitten, a cat holds it in the jaw, and the kitten is basically helplessly in the jaw of the mother cat, and the cat can also defend itself through various challenges without damaging the child. And the other side is the monkey. The mother monkey doesn't have to, she has to just see that the hold of the baby is okay and jumps through. And I'm surprised at how that parachute reflex doesn't come up when she jumps from a tree to the ground in the child, and the child and the baby holds the mother so well. So these are the two extreme examples where the baby has a complete control over its posture and the reflexes and holds the mother, and the other, the, the kitten gets totally controlled or held by the mother cat. Uh, See, in these two, we find uh, extremes of the two examples. We have to find a median. And when we talk about parenting, we have a dichotomy here where we have to address parents of special children differently because we have to educate them about the longitudinal outcomes of their child, because they have a very common question of what happens to them in future and what happens to them after we are not there. And the second is the intellectual group who want their children to be groomed to be perfect human beings on this in this society, and they have normal children. So parenting as such would be focusing on how our same skills, the same set of cognitive and executive functions, or our cognitive apparatus, which works with the society as professionals, as different roles which we play, is used in parenting. And I've been hearing about a lot of people talking about the good thing is, like, recently when I heard about Dr. Shitish in the committee, and then I knew that he is going to be exceptionally good in this, and we are keen to listen to him. Dr. Shitish, he is basically a psychiatrist from trained in UK through MRC program, and is been practicing in Allahabad, Prayagraj, and has been doing a lot of things in child psychiatry. He has been an exceptionally trained person in child psychiatry, and he is a co-chair of that. Has been the co-chairman also of our national organizations, our child psychiatry department of IPS, unit of IPS, as well as the Indian Adolescent and Child Association. So, I would request Dr. Shitish Srivastav to begin his talk, please. Dr. Shitish.
Thanks for a very kind introduction, sir. I'll just try to put up my slides. Just bear with me. So while I'm doing that, it's a very interesting question you brought up regarding why do humans need to learn about parenting. So I'll try to answer that, although I don't think there can be any perfect answer. But so in my view, there are a couple of things which makes it important for humans to learn about parenting. Is my screen visible?
Yeah, you can just enlarge it. You can
Good.
just put it. Yeah.
Yeah, and I'm just
Yeah,
putting it on
slides.
slides. Just a second. Yes, is it there?
Yeah,
You can see it. Yeah,
perfect, perfect, perfect.
yeah, great. Yeah. So a couple of things that I'll use to answer that question. So firstly, if we compare humans with any other animal species, so evolved animal species, we can see that human babies are born at a time when they're not actually ready to be in the world. They need a lot of work before they get ready, as compared to kids of other animal species. They are, when they come in the world, they're nearly ready. So because of this reason, we need to work on parenting to make sure that the environment they get helps them reach their full potential. Now, if we look at why this happens, it has a lot of advantages as well, because when human kids come into the world, they have a lot of potential and they're also very vulnerable to different things, which means that what happens over the next 15, 20 years can decide what they do with that potential and what they do with that vulnerability. That doesn't happen in animal species. So most animal species would have a limited potential. You wouldn't. So, for example, we know that cheetahs can run very fast, and most cheetahs will do that. Whereas in humans, there would be humans who can run ultra marathons, and then there would be humans who cannot walk even 100 meters. So this variability doesn't exist in the animal kingdom. So that is one thing that I want to put across. And therefore, it's important to make sure we do that right, that environmental thing over the next 20 years after their birth. Secondly, while parenting is instinctual, humans have a choice. Animals, generally speaking, they don't have a choice. And whenever we have choices, we make mistakes. And therefore, we need to learn how to make the right choices. So that is why, I mean, these couple of things just makes me think that we need to learn about parenting a lot. That's just to answer your question. I don't know if that answers it satisfactorily, but just my views. So I'll get on with the presentation. So it's parenting in the early years. It's focusing only on the early years. It essentially means for the first 5 to 6 years. Parenting is a huge topic in itself. And adolescence parenting is a completely different ballgame. So we're not going to go there in this seminar. Just to let people know that I work across settings. So I mean, ACDC is my own center in Allahabad. It's Allahabad Child Development Center. And Psychiatry UK is my online UK practice. So I see patients in UK through my online work, because I'm a GMC registered doctor as well. So a lot of things that I speak have been learned across these couple of settings. Yeah. So first, let's understand the importance of early years. So just to tie in with what I was saying, when human kids are born, they're not completely ready. But the brain development starts pretty early, around 2 weeks in utero, continues into early adulthood, nearly mid-20s, and goes through different steps. So there's neurogenesis, migration, creation of billions of new synapses, pruning, and myelination. So this pruning and myelination is very experience dependent, and that's where the early environment, especially parenting, comes in. And early development is very important for development of hearing, the speech, language, and executive skills. So while you can say that in utero development is mostly genetic, not completely, it has there are environmental reasons that can influence how the fetus develops, but it's mostly genetic. Environmental experiences become extremely important after birth. So that's why parenting. So you're all probably all aware of these things, that early kids have many more synapses which get pruned over a period of years, where environment becomes very important. And because there's pruning, so it carries both potential and susceptibility to the environmental influences. There's this concept of critical period. I mean, in very simple words, it means that for every skill to develop, there has to be a specific time scale during which it develops. If you miss that time scale, then either the skill doesn't develop at all or it doesn't develop very well. So just to give you some examples. So for example, a 6-month-old human child can discriminate between 2 monkey faces and 2 human faces. So that potential is there, but by the first year, they can only discriminate between human faces because they're not exposed to different types of monkey faces. So they lose that skill, which was there initially, but it could have been nurtured potentially if they got exposure. And that is the concept of critical period. So it extends to a number of things. Speech is especially relevant. So a 6-month-old child can discriminate between sounds of any language. But what happens then over the next 6 months, 1 year, they get exposed to only one or a couple of languages, and therefore that skill to discriminate between sounds becomes limited, and generally to the language they're exposed to. And because of whatever happens, first few years are quite critical for acquisition of first language. For first language, not for second language. So if you don't get functional language in the first 6 years, you're unlikely to develop proper functional language skills over the next 15. So for example, if I see a child who has no language at 6 years, it's difficult to predict that they're going to develop any functional language over the next year. They might develop some, but it's not going to be very functional. Whereas if the child of 6 years has some language, you can be much more hopeful. So that's the concept of critical period. So we don't want to miss that critical period. So the early years become very important, because if you miss that critical period, the child loses, or at least partly loses, the potential. So with that background, I'm going to talk about the basics of parenting under these headings: parenting pyramid, using play, use of digital technology, and behavior parenting. You might already be familiar with this concept of parenting pyramid. The idea is that the things mentioned at the bottom have to be used in abundance, whereas things mentioned at the top have to be used sparingly. Generally speaking, when parents come to us, they only want to focus on things at the top: imposing consequences, imposing punishment, imposing timeout. They don't generally understand the importance of building this relationship, which is only there if you look at the bottom of this pyramid, which is empathy, paying attention, playing, problem solving, listening, talking. And all these skills are acquired through play. So it's very important to talk about play to young parents. That's the first thing you should be talking about before anything else. So just a few concepts for you to understand what to expect in terms of play from young children. So first, the process of play. So first 2 years, it's generally solitary play. It becomes more parallel in the next 1 year, 2 to 3 years, which means that kids might play together, but they're not actually cooperating. They might play next to each other in a parallel manner. Cooperative play develops a bit later, around 4 to 5, when they involve, when they do things and share things, and they can play lots of games together. So it develops gradually from parallel play to cooperative play. Now, the early solitary play, the first 2 years, is mainly sensory motor. So when I say sensory motor, it means that these kids are exploring things from a sensory perspective, which means touching, seeing, a lot of mouthing, and motor. So throwing things, holding things, exploring the strength of the hands, the fingers, the legs. So a lot of this play is sensory motor. Initially, the sensory play can be quite indiscriminate. It's mouthing, banging, regardless of what object they have. But it starts to become more discriminate in the second year. So which means that if they see a bead, they will roll it. If they have a ball, they will throw it. They will not put everything in their mouth. They will use it according to its function. So it starts to become functional. And then gradually imitation and pretend play develops. So in terms of imitation, I mean, kids very early start to imitate. They are wired to do that. But that is immediate imitation. It takes them some time to use that imitation to learn skills. So that is to remember that imitation. So for example, they might copy, a small infant might copy their mother in terms of facial expressions, doing things. But only later in the second year, they start to use that imitation to learn skills. So for example, copying gestures and using it in a functional manner, or seeing the mummy feed them and they might feed the doll, just basic imitation. Gradually, this moves into pretend play in the third year, and the pretend play becomes much more evolved over the next 1 year. So this is some sensory motor play. The pictures from our center. So a lot of, if you look at these pictures, these are the things that, I mean, a lot of us might have played with our kids. These look like simple games, but they help develop so many different things. They help develop balance, a good vestibular system, And if you don't do these things with your kids, your child may not have a well-developed vestibular system. They might not have well-developed proprioception. They might not have well-coordinated sensory regulation system in their bodies. So all these things can get affected if they don't get to do these sensory motor play initially. When parents ask about what toys they should be using, I mean, there's no specific. It should be a variety of toys, both structured and unstructured. So unstructured things like blocks, Play-Doh, it could be anything, whatever they have at home. And we should encourage them to start imitating very early. So when you imitate the child also imitates you. Again, some more concepts to understand what to expect from your child. So the early stages, in the first couple of years, the child is very distractible. It is difficult for us to direct them into any activity over a sustained period of time. However, in the third year, the attention starts to become channeled. And the reason why I'm telling you this, because sometimes parents come saying that my 2-year-old doesn't focus, doesn't sit. Well, you have to say he's not supposed to sit. He's supposed to be distracted. So we have to be aware of what to expect of a normal 2 or 3 or 4-year child in terms of their attention skills and their play skills. So in the third year, the child starts to become more focused. His attention is more single channeled, which means that if he's doing one activity, he's doing one activity. Once he gets distracted, he will not come back to that same activity. So if he's playing with his ball, someone else calls him, gives him a chocolate, he might just get distracted and not get back to what he was doing. So he needs adult attention to help him get back to his activity. As the child is growing in the 4th year, they are much more able to focus on activities. And they're able to start shifting their attention from one activity to the other, which means that they can ignore distractions to an extent. If they like something, they will do it and ignore other things, just beginning to ignore some distractions. And they can also control their focus of attention. So that's why you see 3 to 4-year-old kids doing lots of puzzles and sorting games where they learn to sort things according to color, according to shape specifically. In the 5th year, attention starts to become much better. They can perform an activity while listening to instructions, which starts to make them ready to go to school, where they can listen to instructions and do things at the same time. So the attention starts to become more multi-channeled. And in the 6th year, attention starts to become much more flexible and sustained. So this is also important to remember, because lots of parents will come thinking that my child has ADHD, my 3-year-old child has ADHD, he's very hyperactive and attentive. And we have to be aware of what is expected before we are able to advise them or teach them about play. So with that background, let's come to play, how parents should be playing with the child. It's this concept of child-directed play. It's essentially, a lot of these things are borrowed from parenting programs, mostly Webster Stratton. The courses on Webster Stratton parenting and Incredible Years. And a lot of this is borrowed from that training program, which I did long time back. So when you teach the parents to engage in child-directed play, essentially it means that you follow your child's lead and interest. You don't decide what the child should play with. You should let the child decide what he's interested in. You should let the child play, and you, as a parent, should join in rather than direct what the child should do. Parents have to be patient. Let the child learn. Let the child make mistakes. But what you want them to do actively is to describe what the child is doing. So this descriptive commentary is a very important part of parents' interaction with the child. We'll just talk about that in much more detail. So when I say descriptive commenting, it is essentially describing what the child is doing. So describing could be the objects. So you can say Arav is playing with a red car. So that's describing the car and the object. Or Arav is putting a triangle shape in the right slot. You have to describe these things in a very simple language the child can understand. This is building up the child's vocabulary. It's improving his cognitive skills indirectly through play. You can also describe what the child is doing. So, for example, if the child is doing a puzzle, struggling with it, but still persisting, you can say that Arav is really struggling to do that puzzle. He's finding it tough, but he's still doing it. Of course, in a simple language, but you can describe the behaviors. Most importantly, you get to describe his emotions. So you can say, Amit has done this really well, or you have done this really well. You must be proud. Oh, I'm so happy to see you doing so well. So you can talk about emotions. So what this does is builds up the child's emotional vocabulary through play. And that's the best way to teach the child's emotion. Name the emotion when the child is experiencing it, or name the emotion when you are experiencing it and the child is noticing it. And you can build the child's vocabulary pretty early through descriptive commenting. Again, we tell the parents to engage in play regularly in a reciprocal manner, have it a special one-to-one time with the child. It should be a consistent activity. You can also extend play for other things like problem solving. So especially slightly older kids, if they're being bullied at school, you can use play scenarios at home, do pretend play and teach them strategies to handle the bully or what to do when you're getting bullied, how to report, those sort of things. So pretend play works very well for these problem situations. Yeah. So that is the concept of parenting pyramid and using play. I wanted to specifically talk about digital technology because literally every parent wants to know, and people have very confused concepts about what digital technology should be used in the early years. People generally focus on the duration. They don't focus on the process and content of the use of digital technology. So I thought I'll especially cover this in the first, how it should be used in the first 5 years. So we've talked about the importance of early years. And therefore, anything that we introduce in the first 5 years, we should be clear if it helps the child's development or can it have an impact. Yeah, so we all aware of this. Just to quote, Socrates once warned about how writing might reduce people's capacity to memorize information. So just to say that when a new technology comes in, people are suspicious. But we know that obviously Socrates was wrong in this case. So we have to be sure whether we don't have to unnecessarily demonize digital technology. We have to use it properly. That's the first message I want to give you before I get into the details. So these are findings from a lot of studies. Rather than putting references at the end, I've put screenshots of the abstracts after the. So you can go through the abstracts after this presentation is done if you want to read more about these studies. So just to look at what some of these studies found. So most parents were not concerned and had no knowledge of recommendations regarding how much screen time should be used, how should it be used, when should it be used, all those sorts of things. Meal times in India are almost always associated with screen viewing. And parents feel that it makes the job much easier. But actually, meal times are a very important time where screens should not be used ideally. Why? Firstly, it's a time for bonding between the child and the parent. Secondly, when the child is viewing a screen, he or she is not focused on eating. He's not exploring the taste. He's just gulping down things. It almost becomes a task. So they don't actually develop lots of things that they should be developing regarding their eating and appetite, which includes not being in sync with the sensory aspect of food, the texture, the taste. It just becomes a task. More than 50% of parents think that screen activities are beneficial, which is fine. But the most common reason is to engage the child as caretaker is too busy or to calm the child. Actually, when I talk about using screens with the child, I tell the parent that you should be using the child only when you're not busy. So don't use it as a proxy parent. If you want to use screens with the child, do it when you also have time, so that you can engage watching at something together, because then it becomes a joint activity. So, but actually, parents do the opposite. When they don't have time, then they give the screen to the child. Just a couple of, you've all come across these common scenarios. Doesn't mean that there's a there's a causal link, but these are common scenarios. So where the parent will say that my child was developing normally till he was 18 months old. When the pandemic started, we gave him the smartphone and almost forgot about him. He had words then, but now at 3, he hardly communicates. And parents feel that it's because of the smartphone. Or a 4-year-old boy is on the screen all the time. When he is not on the screen, he's extremely hyperactive, making him quite a handful to manage. Screens are the only thing that can calm him down. And parents will commonly tell you this. So let's see if it really affects your social or cognitive development or not. Again, a summary from few studies. So they found that there was a negative association with language development depending on how much screen time they were using during infancy. Just to be aware that the recommendations are, in the first 2 years, a child should not be using screens, and he or she should only be using 1 hour per day in the years under 5, 2 to 5. However, it is not just their screen time that is relevant. The background screen in the household, adult, and the child screen time, they all hinder parent-child interaction. So you can call this as technoference. It's not my term, it's borrowed from one of the papers, but it's a nice term, I like it, technoference. So you will see, even when the mother is with the child, they are on the phone with the child. They're not, or there's background TV. So there are lots of things which are there, even though the child may not be actively using screens, but this background technoference will still inhibit the parent-child interactions. Now, what's positive for language development is if you have an attentive parent who engages with the child actively, there's interactional turn taking with the child, for example, book reading. And even if they are using media, screens, it should be joint media attention. Again, I like this term, JME, joint media attention, which essentially what I'm saying, when you play with the child, when you use screens with the child, do it when you have time, so that you, the child, and the screens can all interact in a meaningful reciprocal manner. So greater screen time and less active parent-child play early in life is associated with social communication delays at 2 years. So there does appear to be a link. But just to say, it is not because of the screen, it is because the parent is not available. Because if the screens are used in an interactive manner, like this concept describes, joint media attention, screens may actually be of help in the child's development. So let's not demonize the screens. It's the lack of proper parenting skills that hinders the child's development. Yeah. So similar findings when it comes to cognition, specifically attention and concentration. Again, cumulative rather than the current exposure, taking into consideration child's average screen time. Technoference, which we talked about earlier. Moderate use in childhood actually doesn't necessarily have a negative long-term association. But the earlier the exposure is, the more harmful it is. Obviously, it depends on the content. If they're educational videos, they might be of help. Just want to keep reminding you, screen time may be a proxy for parental practices, to always try and assess parental practices rather than focus on the screen time. And you would all be aware of the recent triple suicide case where the 3 girls committed suicide. And initially, the blame was all on screens, but later it emerged that there were lots of other things in the household that contributed to their suicide. Again, there's this concept of how the screens are used, whether they use in an active manner or a passive manner. So just to understand this, a lot of us have our social media accounts. We have Instagram accounts, Facebook accounts. Sometimes we just doom scroll. We look at this. We look at one of the reels and then keep looking at the reels in a passive manner. We don't decide what we want to watch. So that is passive watching. Active watching might be, I want to learn a skill, a cooking skill, and I want to actively choose the video, or I want to listen to a specific music video because I'm learning. And then I choose to see that video and then learn from it. Generally speaking, the more active your engagement is, the better it is. The more passive it is, the more addictive and more harmful it is. So even for you, see if your use is passive or active. And if it is passive, try to make it more active. Decide what you want to do with the screens rather than let the screens decide what you want to watch. Having said that, there are also certain cognitive training benefits in playing video games, specifically that are goal oriented. And therefore, some of the video games have been used in cognitive training in ADHD. They improve the visual spatial attention, the ability to ignore distractions. So yeah, there's a scope for cognitive training through video games. So they're not necessarily all bad. So when a parent asks you, or when you think whether the screen time has caused ASD or ADHD, just think, the using screen, is it a replacement for other activities? Which means that the harm may not be because of the screen. It may be because they're being deprived of all other activities. It's because of poor parenting practices. That may be related to the poor development, or it may be reverse causality. Children with more attention difficulties simply prefer to watch more screens because they're more stimulating. It moves. It keeps their attention intact. They get bored with dull, repetitive daily things. Whereas children with autism or autism-like symptoms, they avoid social situations, and that's why they may prefer to stick to screens and prefer to watch the same content on and on and on. So there might be reverse causality. ADHD and ASD may make them more likely to stick to screens rather than the other way around. This is a recent paper, actually not recent, 6 years old, but this found that use of screen time, SBM is screen-based media, is associated with children's cognitive difficulties as evident through imaging. So which showed microstructural decreased integrity in white matter tracts that support language, executive functions, and literacy skills. And you can, so these areas which were affected, these arcuate fasciculus, inferior longitudinal fasciculus, uncinate fasciculus, they would have translated into effects on their language development, reading, and emotional regulation. So you can see these are important areas that could get affected. Yeah. Right. So we've talked about parenting pyramid, using play, use of digital technology. Now coming to behavior parenting, which is what parents generally want to talk about, but you should keep it for the end. Unless you have a good grounding on what parenting pyramid is, how play should be used.
भाजी ठीक झाली का?
An important.
भाजी जमलं का?
Sorry.
तिखट वाटले.
Others can please mute
And,
their audio.
Can everybody mute? I mean, that's what my request is. Please keep the microphone on mute.
I'm okay with that as long as others don't get distracted. Yeah, so coming to behavior parenting, it is an important part of parenting, but not the most important part. So again, this parenting pyramid, we have to work a lot on the base of the pyramid, talking, listening, playing, problem solving, all these things. And behavior parenting starts from second tier. Praise first, setting limits later, and consequences at the end. So consequences would mean timeout, and punishment is not advised these days, but you can think of consequences as a form of punishment. Yeah. So let's get into the basics of behavior parenting. So this is what I'll try to cover. How to use reward and praise, how to give commands to your kid, and compliance, how to work on the compliance. Let's look at these couple of scenarios. A 5-year-old kid is playing quietly with his toys. The same kid throws a tantrum when told he can't get a toy car. How do you think parents will respond? If they see the 5-year-old playing quietly, they probably will not notice. They will not say anything. But when he has a tantrum, they might get angry. They might themselves have a tantrum. They may shout. Or in the end, they might give him the toy car. So a good behavior, which was playing quietly, was not reinforced, but a bad behavior was initially negatively reinforced and in a lot of cases later positively reinforced. So if you see what happens, the child uh, engages in a tantrum. He doesn't get what he wants. He persists and then he gets a toy car. So he learns to persist if he's throwing a tantrum. So he is developing a skill. Next time he will not even ask properly for a toy car. He will straight away go into a tantrum because he knows that works. Generally speaking, when you speak to parents, you'll see that they don't often give enough praise when the child is playing quietly. But they do get negative feedback scolding when they're engaging in undesirable behavior. And sometimes even that bad behavior can earn them a reward, because for parents, it's much easier to give him a toy car or a sweet than to tolerate his tantrum. So it's quite obvious. They shouldn't be responding this way. So let's talk about how parents should be praising their children. So a 5-year-old puts her plate in the sink after meals. The parent says, "Good girl." So do you think it's a good way to praise the child? I mean, we can interact a bit, because I just want your views on this. What do you think would be a way to praise the child properly? Do you think this would be a good way to praise the child? Saying "good girl"?
I think we should make the praise a little specific to the specific action that the child has carried out, rather than a general character
Exactly.
description of the child.
Yeah. So this doesn't tell what the child has done well. So it's not a very effective praise, but it's still better than nothing. A 5-year-old puts a bag in its place. The parent says, "Good girl," but you don't do this every day. What's wrong with this?
Talking about doing it
Generally
every
don't
day.
combine. Yeah, sorry, I interrupted you. Go on.
And talking about doing it every day instead of just that moment, appreciating for that moment would be more reinforcing than that would actually deviate the child's attention from the activity when we mention it every day.
That's right. So essentially, even this child has done something well, and even if she hears "good girl," actually it ends on a bad note. So it doesn't feel like a praise anyway. It still feels like a complaint. A 6-year-old completes his meals. Your parent says, "Well done," but you never put your plates away. Again, the same logic. It doesn't actually stay a praise when you combine it with a negative statement. Similarly, you would know that these are not good ways to praise. They should never be combined with negative statements. So how should you be, or how should a parent should be praising their kids? So these are obvious commonsensical things. I'm not going to talk about that. But generally speaking, when you're giving praise, you should make sure the child is attentive and you have a connection with the child. And you do it enthusiastically, genuinely. But this is what you need to know when you're talking to a parent. Firstly, praise should be instant. So there's no point praising a child for something that he or she had done in the morning, especially when it comes to first 5-6 years. They will forget. It doesn't have any value if it's not reinforced instantly. It should not be combined with any but statements, because then that spoils the praise completely. You did this well, but you did not do that. That completely spoils it. And you already mentioned praise has to be specific and should describe the behavior that is being praised. So you should use the principles of descriptive commenting, which is saying what the child did and then praise it. It is also simultaneously building up their vocabulary and telling the child what actually he or she did well. Then praise can be made more tangible by giving the child more rewards. And again, like praise, these rewards should be immediate rather than delayed, even though they are small. And doesn't have to be sweets or something eatable. You can give the child a sticker, a star in their star book. All these things count as rewards. We can give them their preferred activity. So we can say that you've done this so well. You've now we'll go and play your favorite game, whatever it is. Home token economy is just extending this concept of praise and making it more structured and objective. And setting contracts is for older kids, so we're not going to talk about that. But yeah, home token economy, we'll briefly mention. So home token economy works like this. You make a list of things that you expect from a child, whatever it would be. You decide upon the reinforcers, whether the child gets tokens or coins or stars in his notebook or on the tablet, wherever it is, or on the whiteboard. You always reinforce with verbal praise. Do it as soon as possible. And you decide that once the child has a certain number of coins or tokens or stars, he or she can get a reward at the end of the day, week, or month, depending on how old is the child and how much he can delay and how much he can tolerate that delay. Ideally, you may want to tie this with the school report, but it generally is difficult to do that in Indian schools. So you can combine the point star charts with the star charts earned at school. You don't want to start a penalty system straight away, because sometimes what parents do is they give 5 points, but they take away 10 points because he engaged in a bad behavior. I tell parents, if you want the child to learn the system, depend on the system, then you shouldn't be starting penalties straight away. It may be introduced later on. So an example of a star chart. Limit setting. So again, these things start to come at the top of the pyramid, more towards the top. And that's why they're coming in the later part of my presentation. So obviously, spelling rules, boundaries clearly should be there. And these rules should be for everyone. So if the rule is no hitting, no shouting, no abusing, they should apply for the child and for the parents. Because the child learns from parents. We cannot, I cannot overemphasize the importance of social learning here. So what do preschoolers hear the most? It's generally no, stop it, don't do that, can't you listen? Mostly negative commands. So I want parents to also learn how to give more effective commands to their preschoolers. So when I say, we call this positive commands, which essentially means telling them what to do rather than telling them what not to do. So this is telling them what not to do. I want to teach them to tell what they should be doing. So again, some similar do's and don'ts. Get the child's attention. Commands should be brief, specific, and positive. You have to make sure the child understands. And you give him positive attention and praise if the child obeys. Similarly, some don'ts. You avoid giving instructions when the child is busy. You should avoid multiple commands. You should avoid saying things like, which might stress the child. So things like, listen carefully, I'm not going to repeat this again. I mean, you have to say, I will repeat it again. I'll make sure you understand the command rather than putting pressure on him. Strictly avoid questions, sarcasm, and strong emotional content. So questions, I mean, people say this, can't you understand what I'm saying? Can't you sit down? So these are questions and asked in a way which doesn't sound very nice. So again, for most kids, it may not matter, but for many, it may. Especially kids who are emotionally very sensitive, kids who are very hyperactive, kids whose comprehension is not perfect. You want to make sure that the commands, when you give them, they are effective. So what is a positive command? So again, you can unmute yourself. So is don't shout, is it a positive command or a negative command? It's
Negative command.
a negative command. So instead of don't shout, you can tell the parents to say, speak gently. Just a positive way of framing the same things. Similarly, when you tell the child to stop running, although I would never tell the child to stop running, I'm a runner, so I know running is important. But when you tell the child to stop running down the stairs, you could instead say, walk slowly with mommy. Again, a positive command. So you can, I mean, all these things will start to make sense now. Stop irritating your sister. That can be replaced by share your car with your sister. You should never be asking them questions. Why are your shoes in the drawing room? Or why are you not sleeping? You should instead say it's time to go to bed, or something in a more positive manner. So it's important for parents to understand how to give brief, specific, effective, positive commands, especially when they complain that my child doesn't listen, or he gets very sensitive if I scold him for not doing something. Now, what to do if the child doesn't follow commands? Obviously, none of these things, but it still happens. Parents tend to do that. They hit, they get angry, they scare them. So lots of parents will say, if you don't do this, I'll go to the doctor and get you an injection. So compliance training, you have to be clear what to expect from the child. You shouldn't be expecting something from a 2-year-old child, which he or she cannot do. That's why we talked about what attention skills you should expect from your 5-year-old or 3-year-old, or what play skills you should expect. And then accordingly, you should have expectation from your child. And if you want to impose consequences, you should follow through if demands are not followed. So lots of parents will say, the child throw the tantrum, they refuse, child keeps on the tantrum, they give in. They will not follow on the consequences. And sometimes the consequences are so weird that they cannot be followed. So parents will say that if you don't do this, I'll lock you outside the house, which you know that's not going to happen. So that's not a consequence that we should even be talking about. Also, whenever parents impose consequences, we have to make sure that they're not penalizing hyperactive and distractible behavior. That is not to be penalized. A 3-year-old will run around the house. He will be hyperactive. You don't want to punish him for that. So what to do if the hyperactive behavior is problematic? You can either ignore if it's not harmful. You can redirect the child. So, for example, if the child is becoming very fidgety, restless, rather than asking him to sit still or eat quietly, you can just give him a small task. Go get a spoon, or just put this outside. Just give him random tasks. And also tell teachers at school, if you see a hyperactive child, involve him in physical activities. Don't force him to sit quietly. Give him tasks. Clean the blackboard, distribute your copies, whatever. Just any physical random task. And make sure the child is engaged in physical activity. If there are consequences for hyperactive behavior which leads to problem, there should be practical consequences. So I'll tell you what practical consequences are. For example, if the child is hyperactive and spills milk on the floor, the practical consequence is you get down with the child on the floor and together clean the floor without shouting at him, without saying anything bad to him. And that's the practical consequence. You always have to ignore minor irritating behaviors. They're best ignored, especially including tantrums. They're best ignored if you can. You only think of consequences when it comes to deliberate oppositional defined behavior or aggression. So consequences can be used as they can be penalty, but never ever would you stop the physical activity as part of the consequences. So even if the child has been naughty, I will not stop their evening cricket, the evening play in the park. That is important for the child. So I will never stop that. I might use that to stop whatever screen time he or she has, and that actually works in his favor, but I would never stop his physical play. And then you can impose timeout if you can. Timeout is very difficult to impose practically, in my opinion. So just to see what consequences would you give. So a 7-year-old, while painting, has spilled it on the floor. So we already talked about the scenario. You would give a practical consequence, clean it up together. We've also talked about the next example. 5-year-old with ADHD doesn't sit still at the dinner table, or a 6-year-old with ADHD doesn't complete a puzzle. Obviously, you don't impose any consequence at all. A 5-year-old with ADHD is using scissors like a pen on the wall. What would you do? How would you give a consequence? Would you impose a penalty? If you would, what would you do? Anyone can answer? Because this is potentially dangerous. Plus, it spoils your wall. The child can hit someone with the scissor accidentally. How would you deal with this behavior?
I think you can gently redirect them by asking them to give it to you, and then maybe give them a paper in the hand and ask them to cut it under supervision or something like that.
Yeah, exactly. So redirecting them and using scissors in a more meaningful manner. So give them something to cut with, or you can make sure they get scissors. I mean, if you're worried about the harm from scissors, you have to make sure that the scissors are rounded. But there's no point scolding the child for this thing. he's ADHD. He just likes to do something, and he needs more appropriate ways to express his hyperactivity. And the next is obvious. We have to ignore a tantrum, so there's no point talking about this. An 8-year-old hits his 6-year-old sister with a remote and hits her again when she cries. What would you do? So it looks like it's escalating. So you have to de-escalate, remove them first. But would you impose any consequence, or would you consider imposing any consequence in this case? Provided you're convinced that it's the boy's fault, the 8-year-old boy's fault. You would. So in this situation, you would think of imposing a consequence. And the consequence can be, in this case, the best is stopping their screen time. No remote, no TV, nothing. We've talked about this. Realistic consequences typically involves loss of privileges, doesn't involve punishment, never ever physical punishment, and physical activity never to be taken away. This concept of timeout, it's very difficult to impose in Indian setting. Essentially, it means that, it's not a punishment, it's absence of all forms of reinforcement, which means that there is no positive nor any negative reinforcement. Essentially, the child should be staying in an area where there's nothing to stimulate, nothing to punish him. So just time out from all sorts of stimulation. But practically, it's difficult because most Indian households don't have that luxury to have that space separately. So I don't actually advise this because it doesn't work out. So just mention this for.
Excuse me, Dr. Kshitij, we are left with 5 minutes. Yeah, good.
So that's my last slide. These are the take-home messages from this seminar. We've talked about the importance of early years, and that's why parenting is important. Parent training works. It's much more than reward and consequences. It's built on a secure base, parent-child relationship. Digital media can be used, provided you know how to use it. If you use it in an interactive manner, then it's probably okay within limits. Don't just focus on the hours, focus both on the process and content of digital media. It's all relevant. That's pretty much it from my side. And after this, the abstracts of a lot of papers I mentioned. So I just put this at the end, so you can refer to them later when you have the presentation. That's it from me. Thank you.
Great.
And we can
Thank you, Dan.
have some discussions.
Yeah. Thanks a lot, Dr. Kshitij. You have opened up issues which were not known to us. And in fact, our confidence of dealing with parenting, teaching them, which will be evidence-based, as well as so many concepts clear regarding the reward therapy and the play therapy and their basically association with, basically nurturing how the parent-child relationship can be groomed under the modern and current threatening situations of digitalization as well as, expectations of parents. So when we talk about over expectations and over protection of the kids under 6 years, and especially their concerns regarding various habits and their behavior related to the screen time, I think these are very.
Sorry, I lost you for a bit. Can you just repeat?
Yeah. No. It was just a comment on whatever you have said, actually. So yeah. We have been, really been given a lot of inputs by you, and we need to cultivate our habits of communicating to the parents. Now, any questions which will be open to you? People would definitely be interested in asking certain. Do you have anybody? Anybody can ask queries. You can even unmute your mic and ask questions. There is no issue. I thought it would be too many to be. Somebody has asked if would like to understand timeout applicable to age and time, and what if the child refuses the timeout?
Yeah. So I didn't want to get into timeout for the reasons I mentioned above. Timeout, and that's exactly the problem that you've said. What if the child refuses it? So if the child refuses timeout, in Indian settings, it becomes very difficult. So to answer you practically, I don't advise timeout. You need to have a place where there's no stimulation. you don't get that space in Indian households. So it's almost impossible. It sometimes can happen in schools where parents are put in a quiet room, but often it is not done properly. It is seen as a punishment.
Dr.
So
Shirish,
I would not advise timeout.
Yeah, but how many parents really can comply to our suggestions of do's and don'ts? I mean, you require a different kind of a mind setup of the parents to actually accept. Of course, I've found them to be more compliant if they are troubled by their child to the level that they want to do anything, whatever you suggest. But there are parents who would be failing to actually comply to our suggestions.
So there would be parents who struggle to comply. The kids who don't. I mean, essentially, you have to see parenting in the current context where parents are often working. They don't have the time. Parenting is done often by the maid, so it's proxy parenting. So it becomes quite difficult for them to comply in a lot of cases. This wasn't a problem in the past where we have big joint families, but it's difficult currently. So yes, parents do not always comply with what we tell them, but parenting, I mean, what I talk about parenting is not done in a single session. They need to come for few sessions to understand about parenting. In an ideal world, there are parenting workshops which teach these skills in a practical manner. So when I first learned about a lot of these techniques, it was done in a workshop setting where I was there, and there were some parents as well who attended, who were semi-professionals. So you learn those skills in a practical manner, and that's how you would be able to start becoming compliant with what's advised. Besides, if a parent is coming to you, their kids has some problems, so some parents want a quick fix. They want medicines, and we have to be very clear. We don't want to give them medicines. We want to work on your parenting. So yeah, we see different types of parents, and we cannot fix everyone. So I see a hand. I see a hand up. So we can unmute.
Sir, good evening.
Yeah,
I have a
Rachna, you can.
question.
Good evening.
Go ahead.
Yeah.
So, a couple of times. Oh, sorry.
Go ahead.
No, yeah, please go ahead. I'll ask next. Thanks.
No,
Okay, thank you.
we are waiting for your question.
Okay. Yeah. Hi, Kshitij. I think you had covered a lot of the theoretical aspects as well as the practical examples regarding parenting. I have a sort of ethical question to ask. We get a lot of young professional couples who are in the peak of their career. Okay. And they have very demanding work schedules, and they often seek parenting advice. And most of the time, a kid who is less than 3 years is cared for by the grandparents or a nanny. So, can proxy parenting be a substitute in these early years? If so, for how long? And does it come with any, adverse effects?
No, absolutely, it can be, especially when it comes from grandparents or people who are close to the child. So this Indian concept, the attachment is not just with one parent. We know that. Kids in Indian households have multiple attachment figures. So if it's one of their attachment figures, it can work, especially with grandparents, provided they are willing to spend time with the child and work on what you suggest. So to answer your question, I think it works, and I see that happen a lot in my practice, especially with young professionals. A lot of these kids spend a lot of time with the grandparents, and I think that's fine. But it depends. I mean, I would not advise proxy parenting by a maid. That is not, because then they're not emotionally invested in the child. So you have to be emotionally invested.
Thank you.
Dr. Shruti, there is one question which says that does destructive play shape behavior of the child? Outcomes. I mean,
No, I just want to understand what this person. Yeah. What exactly do they mean? Can you unmute yourself and ask the question, because I don't understand what you mean by destructive play.
Hello, sir. Yeah, so what I meant by destructive play was that initially when we start playing with the child, as a therapist also, I'm a physiotherapist, so when we try and involve them in the play, instead of building something up. A lot of times child focus on breaking them apart or throwing things away, and they enjoy that. So at such times, how should we, and whether it contributes to a certain kind of behavior or something like that? Because usually parents come with whatever games I get, he breaks them into pieces and he is not using them properly. So, how should, whether it shapes a child's behavior, and whether it is how to deal with it? Yeah.
So you're a therapist. So if you reflect on your experiences, you would probably realize that throwing away things or breaking things might mean different things for different kids. So a two-year-old throwing things is probably okay because he or she is exploring his physical strength, and also so for him throwing things is okay.
Yes.
Breaking things, so that has to be understood in the context of how old the child is, not
Yeah.
just necessarily looking at that particular behavior. Yeah, so that is one aspect I want to highlight, that you have to interpret it accordingly. So if you genuinely think that the child is deliberately breaking things or is deliberately destructive, also otherwise aggressive,
Mhm.
that might indicate that we know kids copy. So
Yeah.
I would check if that's happening in the household or at school or in the
Mhm.
neighborhood with kids he plays with. So
Okay.
again, that might tell you why this child is behaving in that aggressive or destructive manner. But in itself, destructive play may not mean anything. Also, sometimes in a kid who has ADHD gets bored.
Mhm.
So it's not necessarily destruction. He does it to get a reaction from you. He
Okay.
does it to engage the parent, for example, because his parents don't have time. And sometimes these kids don't get any reinforcement when they're playing quietly, but they do get a response when they're doing things in a loud manner,
Manner.
breaking things, making noises. Yeah. So
Mhm.
then they get some response, even if it's negative, it's at least better than no response.
Right.
Then some other aspects. So some kids may like sensory stimulation, so they may like the noise it makes, for example.
Mm.
So what I'm saying, there are multiple things that might decide why this child is engaging in this specific
Behaving in a
play. So
certain
without
way.
understanding, it's difficult to say. Yeah, without
Okay.
understanding, it's difficult to give a standard answer. If you see what I
Thank you
mean.
so much. Yes, sir. Thank you so much.
Thank you. Dr. Sidhi, can we take one question? I mean, it's from Dr. Smith Parmar.
Yeah.
Here you can even ask, but the question is very simple, that if we cannot go ahead with the privileges as well as taking away the privileges, or perhaps even time out, what else can be added for such behavior in the Indian context,
Yeah. So if this is not working, what I would do is I would go back to the base of the pyramid first. I would check if there's a good relationship between the child and the parent or not. We too often only focus on the behavior parenting. That's why I kept it for the last. In most cases, it's something to do with either the parent-child relationship that has to be built up, or sometimes the child may have ADHD, and we may want to assess for that. That is making him more oppositional defined.
no?
So answering your question indirectly, not giving a direct answer, but
I think, and one more question has come from Richa Panpalia. Dr. Richa, she asked that 1-year-old keeps hitting randomly and behavior is increasing with time. How to deal with this situation? Also, sir, there is a part of, grandparents and other family members getting involved in the disciplining in his or the child's disciplining. How to deal with this? So, multiple input from all family members, emotionally driven.
yeah, multiples.
And emotionally driven by the behavior tantrums and the behavioral problems of the child.
Okay, so 1-year-old, the 1-year-old child is too young to. So if the child is irritable, generally speaking, if that's what you mean, then I would also explore other things, like there may be problem with the child's sleep, appetite. There could be medical issues if the 1-year-old child is too irritable that he's hitting everyone. So I would not just focus on that behavior. I would want to understand what is causing that behavior firstly. A lot of these kids may have medical issues, which they obviously cannot express. they may not feel well, and that's why they may engage in this behavior. So dealing will depend on how you understand. And there's always a role for grandparents, always a role of grandparents, provided it's done in a consistent manner. So what we don't want is father saying one thing, mother saying something else, and grandparents ignoring both the things and doing so. So there has to be some consistency. If the consistency is there, then it's fine.
Dr. Mishra sir has sent you a good comment here. He says it's a very nice presentation. There is no model parenting, and every parenting is unique, and there is no model shoot for everyone. It is one time and lifetime experience for every parents. Our parents never had any parenting training. Yes, that's true, sir. That's true.
Yeah. So I think I agree with what you said, sir. The different types of parenting, advantages and disadvantages. But in this presentation, I did not cover about the conventional types of. So I did not talk about authoritative, authoritarian. I did not go into those. I just went into the basic parenting principles. Our parents never had any parenting training, and I think we covered that initially.
Yes, we started with that
slightly. In this. Yeah. So in the current times, parents don't have time, and they don't have the guidance of an extended family.
I think
so that makes it difficult, and that's why they need to.
And Kshitij, I also feel that the culture which had provided the confidence to our parents when we had, a very unified family structure. So now the parents are singular, or perhaps they are even into nuclear families and working for like 5 days a week, keeping their children with either some caretaker or in the creche. So perhaps the confidence has gone down. I could see parents being very skeptical about the outcomes of their behavior. So sometimes they overcompensate for their absence, long time absence. Perhaps they come back, perhaps they over pamper or overprotect the child. And that's one thing which I have been finding over the last decade, that parents are losing their confidence in their parenting.
I agree, and they don't have anyone to guide them, unlike in the past where they had extended family members to guide them.
True.
Plus, there's so many distractions currently. Yeah. So the different challenges in different generations. So there were different challenges in a previous generation. We have our own challenges, and the next generation will have their own challenges.
Absolutely. So nice, Sanjay. Thank you very much. I think we have covered most of the questions also, and we are very happy to go back with this message that parenting in the modern era needs to be addressed more scientifically, and the parents need to understand their role, reciprocal role, in fact, I would say, when they see a problem. Sometimes
there's one question I think which I want to answer. There's one question which I want to answer. Someone asked, most of us were beaten by our parents. We turned out to be good. So it's difficult to explain to parents that hitting is bad. See, I would give a very contextual answer to that. Whatever we do currently, whether it's good or bad, it's dictated by what is acceptable. So if hitting was acceptable widely, it would not be seen in a negative manner, and it therefore doesn't affect a child, for example. But if it's seen in a negative way, if the society sees that the hitting is bad, and then if you hit, obviously it will have much more serious consequences on the child. So when we were young, when we were growing up, hitting was probably okay. So we didn't think it was anything abnormal. We did not feel that because my parents hit, they are bad parents. But in the current scenario, if I hit by my parent, I will feel that my parent is a bad parent, and that will affect my parent-child relationship, my relationship with the parent. It's all contextual on how the society sees certain practices.
And also there is one more aspect, like the bond between the parent and the child. If the child has full confidence in the parents and the bond is strong, when the parents become angry and hit the child by mistake also, perhaps they have it doesn't affect or dislodge the trust of the child of the parents. Most of the time, the hitting has caused nowadays loss of trust with the parents. So that's where we are missing on nowadays. So earlier it didn't happen because we never lost trust with our parents, even if they punish us physically, Yeah. Right.
I think we're over time.
Yeah.
I don't want to keep holding people for too long.
Yeah. Thank you very much. Thank you, sir. Thank you, Dr. Kshitij. And
Thank you, sir.
thanks everyone for attending so long and in such number. Thank you very much. And we'll be interacting on this issue in future. Thank you very much. Good night, everybody. Dr. Manchuri, you want to
Yes,
say
thank
something?
you,
You are
sir.
really nice.
Thank you for the nice moderation,
Thank
sir,
you,
and
thank you.
thank you,
Thank
Dr.
you,
Kshitij.
Lakshmi.
It was a very nice
Thank you, sir.
presentation, and I'm sure everybody's benefited from it. We would love to pass on the recording also to the people who couldn't attend.
Great.